Okay. Awesome. All right. Good morning, everybody. Thanks for joining. And thank you all for the questions that you've been sending in. It really helps helps our team frame what we want and what we need to talk about and what we need to explain better, and made all of us do more research so that we understand this whole thing better. Certainly learning a lot about MOUs and use and disclosures over last week. So I have a few slides I want to share with all of you, and then we'll have lots and lots of time for questions and we can talk through different things. But let me share my screen and just share a couple of quick slides that hopefully will kind of explain the situation a little bit better. Right. Okay. So this is open office hours on the AAA's MOU and use and disclosure. Lots of alphabet soup. So the first thing we're going to do is try to define all of those alphabets, all those letters. And things I want to touch on first is who are the area agencies on aging, what is a memorandum of understanding, and how that affects the use and disclosure, the team meetings and the visitor agreements, and some next steps. And then, like I said, time for questions. So first of all, the area agency on aging. So there are 5 different area agencies on aging that serve different areas of the state. In Chittenden, Addison, and Franklin County, that is AgeWell. So you probably know them as AgeWell, not as the AAA. Likewise, in Southwest is Southwestern Vermont Council on Aging. We have Senior Solutions, Central Vermont Council on Aging, and in the Northeast Kingdom, the Northeast Kingdom Council on Aging. So those are the folks we're talking about. Hopefully, those are the folks who have been coming and are still coming to your team meetings. Sorry. And then, so these are the folks who have elected to not re-sign the MOU. And this is a decision made by the statewide leadership of the area agencies on aging. So kind of like SASH, they have a statewide administrator of all of their programs, and then they have these independent agencies around the state. So the statewide leadership has decided not to sign the MOU. And what it's mostly about is that feeling like SASH duplicates a lot of their services. So they are ending the formal agreement with SASH, but the messaging that we're hearing from them is that they very much want to continue to work with us, continue to collaborate, and continue to offer services to eligible older Vermonters who are being served both by SASH and by the AAA agencies. So we're going to continue to be doing referrals, and hopefully them referring to SASH and SASH referring to them. The process is just going to need to look a little bit different. All right. So this is just a sample of a memorandum of understanding, or the MOU. This is the memorandum of understanding for Chittenden County. As you can see, this is effective January 1st, 2019. So that's the last time we had an MOU signed statewide. And in this case, it was with AgeWell, but you can see also on this memorandum of understanding are the housing hosts. So Burlington Housing, Champlain Housing, and the Mental Health Center, which in Chittenden is the Howard Center, the University of Vermont Medical Center is the hospital, and the University of Vermont Health Network home health agencies, and Cathedral Square. So each one of your areas has their own memorandum of understanding with local agencies. And these are what is getting redone right now. So in 2023, this year, we need new updated MOUs with all of our participating partners. The area agencies on aging are not going to sign this, but we do expect all these other partners to sign these agreements. So a memorandum of understanding does 3 really important things. It formalizes the model, the SASH model with our core partners in order to enhance the function, quality of life, and independence of our participants.
Yeah.
It really makes sure that our partners understand what SASH does and all the pieces of our work. It also ensures statewide consistency, defines who the partners are, what we mean by a SASH team, and the roles and responsibilities of each member of that team. One of the responsibilities of a lot of the partners is to come to SASH team meetings. And it also very importantly permits for a clear framework for the sharing of PHI or personal health information for the purposes of care coordination. And that's what really ties into the use and disclosure. It allows us to talk to these people, right? Did I miss my use and disclosure one? Sorry. Okay. So the some next steps, so what's going to happen now is there is a statewide partner meeting that's actually happening at 10 o'clock today, where Liz, the SASH director, is going to be meeting with other partners, statewide partners, and they're going to discuss the MOU. The next thing that will happen is the partners will hopefully all approve the MOU and sign it. And then the local partner meetings will need to be set up by the implementation managers and local leadership. Then hopefully they will all sign the MOU. Then we will need to once again update the use and disclosure and our privacy practices and all our legal paperwork. And we will share that with you. And then the housing host agreements will be updated to reflect the new MOU. So there's still a lot that's going to be happening over the summer around this. So what we need for you to do today are just a few things, and there'll be more to do later in the summer when all of this kind of gets finalized. So the steps for SASH staff to do right now, which was mostly all spelled out in the email, but it's to update your use and disclosure and remove the area agency on aging from the partner section. So that's the top part, which we'll look at in a moment. For team meetings, you will need to use the visitor agreement for any of the area agency on aging case managers to attend the SASH team meetings. It would probably be best practice for someone to be communicating that ahead of those meetings, whether in most cases that's going to be the implementation managers. But if you have really close working relationships with your case managers from the AAAs, it could be the SASH coordinator or even the wellness nurse who is making that communication. And we do have an example of what to say and how to communicate that for you. And then lastly, expect additional updates to the use and disclosure once all the MOUs are finalized. So this is, and we can share this afterwards. Really thankful to Shauna, who's here. So thank you, Shauna, for sharing this letter that she emailed to the case managers she works with at Senior Solutions. So this is the letter she sent and also the responses, which were very lovely from the case managers. As you can see from her responses, they were not aware, at least when this went out, I think early this week, they were not aware of this change and were very willing to sign the confidentiality agreement and continue to meet. So that's really encouraging. And thank you so much, Shauna, for doing this and sharing it. I think this was really helpful. And again, I know you probably don't have time to read all of this at the moment, but but we will share it afterwards. And we have this recording too. So this is the template of the use and disclosure, which we've shared with you. This is, of course, the main legal document for all of SASH and for all of the work you do. So this is what we ask our participants to sign every year. You do not need to have people re-sign these right now, just because we're taking the AAAs off. So that when they become due, they need to sign the new one. But you don't need to re-sign everybody on your panel right now, just going forward using the new template. So at the top of the use and disclosure, there's brackets. So the name of housing host, name of home health agency, name of other core partners identified in the MOU. This is one place where you need to take out your local area agency on aging, is this top part. Additionally, it used to be listed here, so you will also need to remove that from your use and disclosure. And we still obviously want to be able to communicate with them, especially on any participants who are currently receiving their services or folks you might want to refer to your local area agency on aging. So the current recommendation is to write them in right here. Write in age well. If you have a case manager's name, you can put that as well. But the recommendation would be not to only put that person's name, because if you only put that person's name and they leave or they're on vacation, then you may not be able to communicate with whoever is covering. So putting in the name of the agency is best practice there. And then the visitor confidentiality agreement, this we also shared in the email, so you should have a copy of it. This is what you need any case managers who are not on the MOU to sign when they come to your team meetings. And this can be a one-time signature, and it's good for a year. You need to file those or keep them somewhere secure. And I think this is my last slide before we open it up for questions, and I can certainly go back to, I know if you have specific questions about some of these, but this is where to find the most updated legal documents, including the talking points, the use and disclosure template. Make sure you use the Vermont one for Vermont folks, the Vermont notice of privacy practices, explanation of benefits. I think actually you were going to talk to this, Jen. Am I covering it? Sorry. Roll it along.
We just wanted to make sure that everybody knew where to find these updated documents. They're on STAR under the SASH tools legal documents page. Everything on here has been reviewed and updated as of yesterday. So you can be confident that if you're getting it from here, it's ready to go.
Thanks, Dan. All right, and I think, yes, so that was my last slide. So questions, and you can chat or unmute or raise your hand, whatever works for you. I can certainly go back to any of these slides if you have specific questions on. Thanks. All right. So question, do we only need to keep the current use and disclosure on file?
I was trying to find like the old, like there's a sheet of paper that talks about the filing system and like how long we need to keep things and all that. So I was trying to find that yesterday and I couldn't, but just trying to clean up my filing cabinet stuff for the hard copies. I know I can upload them, but I know for paper copies, if something is 6 years old for use of disclosure, can I shred that?
That document's on the legal page as well. For a reminder, it's in like the upper right-hand corner of that legal documents page, STAR.
And I believe our guidance on that, Tracy, is to keep those for 10 years because the reason for that is in PHL, there is no, you can look up whether it's currently signed, but there's no way to look up whether there was one signed on August 1st, 4 years ago. You know, that kind of historical information isn't stored in PHL. So unless you're uploading them to PHL, you should be keeping those paper copies for at least 10 years.
Okay, yeah, I was aware that the 10-year time, I just didn't know if that applied to the use of disclosure since it wasn't current anymore, but okay.
Yes, it is. Yeah.
Hey, Casey, this is Jody.
Yes.
Question. So I'd be curious from your involvement with the AAAs and what their perspective, like you said, it was their perspective on duplication of services. And because I recall early in the SASH program as it was rolling out that it was a priority of ours to minimize that. It was like a responsibility of staff to identify last hit on the block. We're working with all the partners and communicating with them explicitly to minimize that. So I'm curious about what specific duplication these state leaders found.
I can also let Liz speak to that. I know a big part of it is about our expansion or more serving more and more community participants. We did push back quite a bit, saying, you know, this MOU is one of the main ways that we prevent duplication. You know, coming to our team meetings is how we prevent duplication. Liz, do you want to speak to that?
Yeah, Jody, thanks for the question, because it's been a tough to come to it. We didn't come to an understanding with the AAAs regarding duplication of services. I think we respectfully disagree. You know, working within the SASH model, they weren't concerned about duplication of services. They were thinking more globally. You know, SASH is doing wellness nursing, and now they're doing some wellness nursing. You know, we're doing similar things. And what really stood out to them was our pilot with the Vermont Blue Advantage Medicare Advantage plan, which is definitely not in congregate housing sites. So that was, I think, healthy conversation around how that came to be in Chittenden County. And we made some agreements around potential expansion of going through Medicare, because that's different, right? That's new. And that wasn't part of the MOU. So that was some good conversations. But honestly, we didn't quite understand their perspective. And it certainly wasn't within the SASH model that they were citing duplication. It was more, in general, you do similar services to us. And unfortunately, they didn't see the benefit of staying within our framework, even under this one SASH model.
They shared several examples of duplication, which felt kind of unfair because those should have been handled at the time in the local place, as opposed to kind of held onto as a whole list of examples of how we duplicate. Obviously duplication happens and we need to address it when it happens and work it out by communicating with our team members so it doesn't happen again. That's the intent of open communication and the intent of the team meetings. So that's for your question, Jody.
Thank you, that's helpful.
So a question from Sue. So the only big change is that they have to sign the form to attend the meeting. We can still do referrals and talk to them about participants regarding the referrals. Yes, that is correct. Again, you should make sure that you are writing in on new use and disclosures, writing the area agency on aging that you work with onto the use and disclosure in that lower section. But yes, you're going to continue doing referrals to them, can continue to talk to them. If you have a use and disclosure that's older from like last month, as long as it's still up to date, you can still talk to them and share information with the AAAs. There's another question in the chat. I'm wondering, yes, go ahead.
One distinction I wanted to make that is different is, and correct me if I'm wrong, but if the AAAs are attending your meetings, they just won't get paid to attend those now. So that might be something to disclose, just as it might not be glaringly obvious to them, but just to let them know.
Kat, I'd like to comment on that. I'm just curious if their employer or their boss would be the one that would inform them about not getting paid if they chose to attend. It doesn't seem like it's a SASH staff responsibility. It just seems awkward to me.
Yeah, hopefully they will be hearing about this from their employer. Shauna's experience was they had not been notified by their employer, but that maybe that just hasn't happened yet. And I agree that payment part doesn't feel like a SASH staff responsibility. It certainly could be something that the IMs might want to mention if they're communicating with them, but that doesn't feel like a SASH coordinator or a wellness nurse piece. So MJ said, I think you mentioned this, the waiver and release form will have blanks to fill in as well. And yes, so I can share that again, share my screen. So here we've created a blank area for local area agency on aging to write in here. That's where you would write in AgeWell or Northeast Kingdom Council on Aging. You can write that in here. Does that answer your question, MJ? No, I can't see the chat.
Casey, so MJ was asking about the waiver and release document.
Oh, okay.
Which is different than this one. So the waiver and release, the notice of privacy practices, and the explanation of SASH benefits all on the legal documents page all have places to write in the local MOU partners. And those have all been updated on STAR to reflect this change. So if you're using that newest version, you should have a good template for making sure that those are not included any longer.
And to your question of will they have a blank to write in, they will not, because those are specifically for the partners with an MOU. The question about whether the privacy practices and the waiver release, yes. Whether those need to have them removed, yes. So they will all need to have the AAAs removed from those documents. I do want to highlight though that this isn't an urgent thing. You don't need to go and spend the day today removing all of those from your documents. This can happen over time, over the next couple of weeks as you're updating those. A lot of them should be coming from your implementation managers. I know some of you might be doing them yourself, so we wanted to make sure you had all this information, but there is not a huge sense of urgency with this. We have talked to our lawyer, and we're very well covered under HIPAA rules with what we do. We go kind of above and beyond with our HIPAA protections, so you don't need to panic about this or make it or do anything immediately. Liz, did you want to add to that?
Yeah, I just want to also keep in mind that with MOUs for 2023, ideally getting rolling, and in your local areas, some people are already discussing, gosh, I want to add BIATA to my local MOU. So that would also trigger an update in your use of disclosure and all those things. So it's okay to wait if you know you're going to be adding more people to your MOU, especially. So you don't do it more than once. And it's like a full disclosure that you'd want to have, we'd have to see. So if you already know that, just keep that in mind. That's all.
Trying to keep up with the texts. So Sabine is asking, to clarify, they will still get paid by their employers because they're still doing working hours. So yes, that is my understanding. So if they come to our meetings, they're still working and they are still being paid. It's really their employers that are no longer being reimbursed for that time by SASH. So they are still on the clock for their own agencies. So thank you for clarifying that, Sabina. So Colleen said, here in Rutland County, when we first started SASH, the AAAs didn't want us doing anything in households we shared if they could be paid for the service. The pandemic hit, we could do all the tasks they didn't want us to do previously. And now that the pandemic is over, they don't need us to pick up the slack any longer. I will say, Colleen, to your point, that this is kind of been a long simmering challenge with the AAAs, and this is not a new issue. I've had people from the AAAs come up to me and be very upset about our work on numerous occasions in public places. So this isn't new. Give Liz a lot of credit for being positive and professional in lots of meetings with the AAAs over the last few months. But you're right, this is not a new situation with them. And I think we need to continue to work with them and with our local partners the best we can, and encourage them to stay involved with SASH, encourage them, continue to refer to them, and continue to partner with them the best we can, because a lot of this is a statewide leadership issue more than a local people issue. Gary is asking, who should we send the confidentiality agreement to? In general, you can just bring it to your next team meeting and ask folks to sign it when they come. I know Shauna had emailed it as an attachment, so they had a heads up and could look it over. Either one of those is fine. I think it can go directly to the AAA leadership if you think that would be helpful. I don't think there's a one right answer for that, Gary. It's a very good question, but we've often, if we have any visitors or an agency that isn't on the MOU coming to a team meeting, this is the form we suggest that we want you to use. So this isn't new, it's not unique to the AAAs, and it's a very simple confidentiality agreement. So if we meet in person with a AAA case manager, not at a SASH team meeting, it's okay. It's okay as we have an active use and disclosure. Yes, that is correct. You can still meet with them, talk with them, as long as you have a signed use and disclosure. Yes. MJ commented their loss, and I totally agree. It's definitely disappointing, but does everyone need to sign the visitor form or just the AAA rep? It's just the AAA representative that needs to sign that. The SASH coordinator doesn't even need to sign that. It's just them and the name of their organization. And basically they're saying that they're going to keep the information they learn in the team meeting confidential and private. That's what the MOU says. So because they're not signing the MOU, they now need to sign that form. And the visitor confidentiality agreement is valid for a year. Yes, that is correct. It should say so on the form. I agree. We could add that to the form, making sure it says that valid for 1 year. So that's a good suggestion. That is everything that's in the chat at the moment. Other questions?
So that visitor form, they would just do one per panel, or is that?
It's one per person.
Okay.
So if you have a case manager and they sign the form, and then the next month a different case manager comes, they need to sign the form. So probably best practice is just to have some blank copies of it that you can bring along to your team meetings, and have folks sign it as if somebody new comes. Same would be like if somebody brought their intern with them or that kind of thing.
Okay. But if one case manager's on the Zoom call for the whole panel, they just need to sign one for that whole meeting. Yeah.
Yes, that is right. Yes. Yeah. I was just looking at some of the questions that came in on email to see if I covered all of those. One question that we were asked by email is about marketing materials and brochures and removing the Council on Aging as partners. We will need to do that eventually. Again, we're going to wait a little bit on that just to have all the MOUs finalized and do that all at once, especially because that's a kind of an expense to print all those. So you can certainly continue to use the marketing materials you have right now, even though they say that the AAAs are a partner on there. We will be updating those later in the summer, and we'll let you know when that's all finished. And so we have not had an in-person team meeting yet post-COVID. I know that has certainly been challenging. A lot of folks are continuing to do them virtually, which is a lot easier for some partners, a lot less time commitment for driving to these meetings. So continuing to do them virtually is fine. If you need assistance with trying to get them set up, certainly talking to your IM, you can reach out to the SASH admin team too. We may be able to give you some suggestions on getting those started again. This is a great time because all the conversations are going on around the MOU to really engage with partners. So trying to get those started would be awesome. Jody asked, do the use and disclosures say community health team still or PHSO? I'm not sure what PHSO stands for, sorry. Are they considered the same to use as the network makes these changes? Jody, do you want to unmute? And I'm not sure what PHSO stands for.
I'm kind of forgetting what PHSO is, but I'm seeing it in signatures and the network, UVM Health Network, is some of the staff transition from community health team representatives to PHSO. Anybody else? I'll look it up because I'm forgetting myself.
Yeah, I'm not sure what that stands for. I think in general, the community health teams haven't been on the use and disclosure in that they're also a group of partner agencies as opposed to a group in and of themselves. I see Liz nodding. So I think I'm saying that right.
Yeah. Maybe Liz knows because Public Health Service Organization. Thanks.
Okay. Yeah, and so those are not on the use and disclosure because they are collections of groups of other people. So a lot of those partners are on there, like the local mental health or the local hospital. But as a collaborative group, they wouldn't be on the use and disclosure in that way.
So then, Casey, are you saying that the community health team representatives fall under the Public Health Service Organization? Like that's the umbrella, the Public Health Service Organization, and all the other representatives, as their titles change, it just gets confusing for us, I feel like, out in the community. Like who's what, their titles are chronically changing. We don't necessarily get updates. So it's kind of imperative to stay connected, try to, know who we're talking to. And if we need to make changes on any of these legal documents.
Yeah, absolutely. And hopefully Jen LePan can, and all of your IMs can really be the lead on that piece of it. And we'll be over the next couple of months meeting with all of these partner agencies, making sure that the correct names and titles of the agencies are on the MOU, encouraging getting as many of them on the MOU as possible so that you can have really open communication with them. And certainly this is a good time especially if you're in one of the more outlying areas, be communicating with your IM about who your partners are that you really want on this MOU. So they can reach out to them, invite them to these conversations and local table meetings and get more folks added to the MOU. Whether I know that the home health agencies are not covering some areas. And so is there another home health agency that you want, like BIATA or some other agency that you want to be able to invite to team meetings or collaborate with in a closer way. I'm missing some chats here, so. The FQHCs are another one, the federally qualified health centers are another one where we're hoping will join some of the MOUs. So I can certainly stay on and happy to take more questions. I don't know if anyone else on the SASH admin team has anything else they wanted to add. Also, definitely encouraging folks to keep emailing in questions or situations as they come up, because it's like I said, it is really helping us learn more about this process and give clear information back to all of you when we know what the questions are and what you're running into out in the field. Both successes and challenges. We want to hear from them, hear about both of those so that we can support all of you. So I'm going to stop the recording, but again, I'll stay on for a bit longer if folks have questions.